Brown is a truly special place. I've always known that it's been famous for having a spirit of interdisciplinary collaboration, but since coming to Brown, it's really true. It's in the DNA of this university and certainly in the DNA of the School of Public Health.
What happened was between gerontology, alcohol and addictions, statistics, international health, these broad initiatives work together to forge new processes for the university in order to become leaders in the field in these emerging areas.
People from different disciplines work together as a matter of practice, and they roll up their sleeve to tackle hard problems.
We have all of these tools, we have all of this expertise, we have all of this knowledge. How can we leverage these resources to work on a problem that's meaningful for you?
We are probably the go-to place in the world for behavioral science around addictive disorders. And what we've done over the past 10 years is brought that to the forefront. And the School of Public Health, I think, has allowed us to do that.
We study, quote unquote, the study of aging, which is gerontology, and how that translates into understanding people's lives as they move forward. But the real issue is what it means for the delivery of care to those people and their care partners and their families.
For a long time, Alcoholics Anonymous was totally against harm reduction. Abstinence was the only way. And my work and the work that we do at the Center for Alcohol and Addiction Studies, a treatment that teaches harm reduction skills has emerged as the treatment of choice in these clinical trials. So to get these individuals to reduce in a harm reduction sort of way makes the most sense both clinically and empirically. We know that it works much better than trying to get kids to abstain.
We were working with one of our colleagues, a nursing home company, and they transferred their entire electronic medical record to us every night. And then my research team met with their clinical people to try to work with them about what their problems were and what they needed to know to best solve their problems in the field. That is really some of the greatest sort of applied health services research that's been done, to my knowledge, and it's one of the things that I was most proud of being involved with in the 40 years I've been here at Brown.
People like to talk about COVID as being a once-in-a-century health crisis, but it's not actually true. The reality is all the data that we have suggests that pandemic threats are going to continue to happen. They're going to happen more and more frequently. It's critical that people have access to the right information. And in this world, it's increasingly hard to find the right information. So we take very seriously our roles as sort of trusted independent source of data and facts. That's why the Pandemic Center was created, and that's what we're going to work on doing.
We're ready to embrace the changes that are coming about where we need to be able to integrate clinical medicine sciences with public health and epidemiological and health services.
All of my approaches until I got to Brown were, you're not a community organizer, you're a scientist, or you are a community organizer and you're not a scientist and you need to find somewhere else to go. So this was the first place where I felt like I could dream and I could implement and it could be considered valuable.